Hi everyone, and welcome back to my channel. So today I have alternative medicine red flags part 2. So if you guys haven't seen my alternative medicine red flags part 1, I'll try to, I don't know how to do all of the linking, but it's here on my channel. Probably, I guess, just type it in alternative medicine red flags. I made that video a while back. Um, and I actually went back and I looked at it and I was like, those are like very like in your face red flags, right? They're very much obvious. Like I was listening to it and I was like, oh, that's kind of obvious. Maybe not to everybody, but it did seem kind of obvious to me. I might repeat some of those here because they're kind of gonna fit into everything else. But when I was looking at my current list, these are sort of like less obvious. And I want to say something too. I call them red flags. Um, I'm making this video as much for patients as I am for alternative medicine practitioners. I don't know if they care. I don't know if they're going to watch my video. But I do think that there are a lot of issues in the alternative medicine realm, and most of them have to do with the way that alternative medicine practitioners approach their medical practice and the way that they talk about what they do and the medicines that they use. Um, and so I think, if these doctors or if this profession wants to be taken seriously, because there are a lot of people that believe it's a scam, and there are a lot of scam artists out there that are in the alternative medicine world. Do these treatments or whatever they recommend, does it work? Can it work? Yes. Um, but it's not. They have. I feel like alternative medicine practitioners have to understand that there are limitations, and also too that everybody is different, and we will talk about that here. So, as you guys know, my number one biggest red flag is you need to believe it in order for it to work, right? If you don't believe, it's not going to work. And I did do a video about this recently about a naturopath that I met out here. I'm in Puerto Vallarta, and she committed, this mortal sin of telling a patient, listen, you need to believe in order for this to work. And she told this man, something to the effect of, if you don't believe it, your cells are going to they're gonna they're going to register that you're not believing, and they're going to tell your brain that, and the treatment is not going to work. And it was funny because that was a different take, right? That was a different take on it. It was like I'm trying to make it sound scientific, like your cells have to believe, right? And your cells give the messages to your brain. So it was funny to kind of hear sort of the more advanced version of you need to believe in it for it to work. And basically what that's saying is these treatments don't work. They're basically placebo, and if you don't fall for it, you're not going to get better. That's literally what you're saying if you tell a patient that. But that's my number one red flag, and that was also in my other video. I just wanted to give this example. If you want a full story of this naturopath, I did a video on that. I think it's called like a letter to naturopaths, or my message to naturopaths is probably what it's going to be called. Because I'm basically talking like I want naturopaths to listen and to hear what I'm saying. But that is definitely a red flag, and it's you're basically telling a patient this doesn't work. It only works because you think it does. That's essentially what you're saying. So there's also the and I did talk about this in my last video, my part one, that I talked about it differently though. And it's being dismissive. Basically saying like, oh, my sister had that and she's better. Or, oh yeah, my sister dealt with that too. Or I have that too. That's basically people that just don't care. They just don't want to listen to you. That usually, this has happened to me a lot with family members. Hearing it coming from a practitioner of any kind is just, it's a level of unprofessionalism that I cannot, that I truly can't believe, to be quite honest. And this same individual that I was talking about did this as well to the gentleman, basically saying, you know, oh, my sister was like that for 2 years, and she had it, and part of me was like, is she trying to relate, or is she just dismissing this person? And like I said, I've had people in my family do this to me, which is, you know, it's not good either. But to hear someone, a practitioner, actually say that to a patient, I was just like, whoa, you know, this lady, it's not good. But you're going to meet people that are going to do that. Lots of people that are going to do stuff like that. Like I said, a practitioner should never do that, though. And that goes right up there with the I cured myself, right? Because I had it and I cured myself, I can fix you too. And that was in my first video, the I cured myself story. I'm also a patient. That goes right up there with the I cured myself, right? I'm also a patient. I've also been through this. And look at me now, right? So if I can fix me, I can fix you. That's not how it works. Everybody is different. Everybody responds differently to treatments. Everybody is at a different place in their illness. Some people are more advanced. Some people are not as advanced. And, you know, it's just different. Saying that to someone that, you know, I'm also a patient. There's a self-centeredness, and I did talk about this in my video where I gave that example of this naturopath, that there are people or doctors or alternative medicine practitioners that are very, very nice, that are very, very sweet, that are very kind. That doesn't mean they're empathetic. Empathy is something very, very different than just being nice. And being empathetic is you know, feeling their pain. And obviously, if you're saying, well, I had that too, and I did that too, I think they feel that that's like a cheat sheet to empathy. It's not. You just, that's just showing me that you're self-centered, right? That's what that's telling me. Another thing that I have recently picked up on while being here, going along with the niceness, is being overly complimentary. Having a practitioner or someone that is overly complimentary. And this also, there's going to be another one here on the list about boundaries, and I feel like this one falls into both categories. Being over complimentary and being overly nice and kind of overstepping boundaries. So complimenting someone, oh, your eyes are so beautiful, you look so nice today. And I want you to kind of, there was something that struck me with this, because it was a woman that was telling me this. But then I started thinking to myself, if it was a man telling me this, for example, one of the nurses, that wouldn't fly. So why would it fly if a female practitioner does that? And I thought to myself, if one of the male nurses had told me that, like, your eyes are so beautiful, you know, you look so nice today, I like what you're wearing, you know, I think there's a boundary violation there. And again, I feel like there's something to that. Like, why are you, you know, I don't mind the compliments, but why are you doing that, right? You're a professional. You are, you know, if you want to be taken seriously, a doctor's not going to tell me that. A physician isn't going to tell me stuff like that when I go to the doctors, when I go to urgent care, right? They're not like, oh, you look so pretty today. So, you know, that's something that I feel like needs to be paid attention to, is there's a boundary being crossed there, and there's also like a lack of professionalism, and there's just something weird about that. And again, that also goes along with trying to convince you, right? Trying to convince you that you're better. And that's one big thing. I've noticed that. I've noticed that with my family. Again, with families can be ignorant. They don't know what you're dealing with. When it comes from practitioners, it's a whole different situation. And so I have had a couple of, you know, you look so good, you're looking really good, your skin looks really bright, you look really good. And I've had that from some of the other patients that are getting treated, but I've also had that from some of the practitioners, you know, there. And again, that's sort of the dismissiveness, right? My sister had this, you know, for 2 years, and I had this, and I also have this. There is a dismissiveness, like, instead of asking you, how are you feeling? Because I think that's kind of what it was preceded by. How are you feeling? And then it's like, but you look good. Like your face looks good. Your face looks brighter. It's like, yeah, a lot of this stuff that you guys are giving me helps with hair and skin and nails. Obviously, my skin's going to look good because it works for that. That's not the issue, right? And my skin was pretty decent when I arrived. So, it's again that dismissiveness. And that to me is very subtle. And a lot of times, buttering you up, because you want to get a good review, because maybe they're picking up on the fact that maybe treatments aren't working or things aren't getting better. So it's like, okay, well, maybe if we're nice to her, or maybe if we sweet talk her, things won't go that bad or something, right? Or I have seen that they're dealing with other patients who are a little bit more difficult, and so maybe they're kind of like, okay, we know that guy's not happy. We need to make sure that the other patients are happy, or that we're really nice so that we don't have any other issues with these other patients. You can't, if your therapies work, if these things that they're doing work, you don't have to butter up your patients. You don't have to sweet talk them. You can simply just do the treatments and they should function the way that they're supposed to. So there's a lot of boundary crossing, not respecting personal space. In the video of the naturopath that I made, I talked about how she sat on the armrest of one of the patients, and she was very close to him. She was very, in his situation. And again, if the roles were reversed, if a male nurse sat on the armrest of my armchair, how would that fly, right? Would that be okay? You kind of have to look at it that way. And again, lack of professionalism. It's telling me you're not a professional. Even though you're a naturopath, that doesn't mean that you can lack professionalism. You still have to be a professional. You still have to have, especially if you're legitimate, right? If you're the medicine that you practice is legitimate, then you're going to behave like a professional. So that, respecting personal space, that's one of the new ones that I saw. I didn't realize that. And to be honest, I do think that when it comes to naturopaths, chiropractors, people that are in alternative medicine, because they tend to have, quote unquote, woo-woo beliefs, energy and light and whatever, they sort of feel that being close and being touchy-feely is okay, and it's not okay. It's not okay. Don't touch people. Don't get close to people, especially if you're the professional and they're the patient. You need to have that boundary there. Let's see. So there's also one of the things that I've noticed is, again, kind of piggybacking off of the complementary thing, over-explaining, trying to make things sound like legit and scientific. And so, I've had, like I said, I'm at a holistic clinic. I knew what I was getting into when I came here. So I knew that the types of treatments they were going to use were going to be alternative. Some of them were going to be controversial and a little bit out there. I've done a lot of this stuff already. And so one thing that I've noticed is that with some of the treatments, or even they've done like assessments, legitimate assessments, sleep testing and some other stuff. But I feel like they try to legitimize it by over-explaining it and over-explaining and explaining and explaining. And do you see this? And do you see the structure of your face? And do you see how this is like this? And do you see how this is like that? And really getting in and having these long, drawn-out conversations. I've had that happen to me twice with two different. One of them was a doctor. I think the other one, I think she might be like a physical therapist or something like that. And it's like, you can't bring legitimacy to something by explaining it over and over and over again, or by trying to make it sound scientific. Once again, if it works, it works. If you believe in this type of therapy, it's going to work no matter what. Whether you explain it to me, or whether you over-explain it, or whatever. If it's something that works, it's something that's going to work. And I think a lot of times when they do this over-explaining, it's because they want to avoid a problem. because it's such an out there type of therapy. It's such a weird kind of therapy and not exactly foolproof. They want to bring some legitimacy to it by explaining the science behind it or whatever kind of science is there, so that you don't get angry when either it doesn't work or when you have to pay hundreds of dollars for it, because I paid hundreds of dollars for both of these things. These were expensive and probably unnecessary. But I mean, again, I signed up for it. So, but there is that over explaining and trying to explain to you the science and the, this is how this works and this is how this goes. And again, if you're finding that you have to explain something in depth and for hours, then it's just, it's just not, you're showing me that you have doubts about it, right? You're telling me that you're not exactly sure that this is something that's probably going to work. That's what that's telling me. And it's very telling. It's very telling the way that an alternative practitioner operates and the way that they talk and the way that they act tells you a lot about the legitimacy of what they practice. So there's that. Not giving straight answers. So this kind of goes along with this, the over explaining. It's kind of like the opposite end, not giving straight answers, not explaining anything. So this happened, if you guys have been watching my exosomes videos, this sort of happened with my doctor, and she's an actual doctor. She's an MD, but she does a lot of alternative, integrative types of stuff. And, not explaining things, not answering questions, beating around the bush. I would ask her, like, why did this happen? How come the treatment didn't go well? And it was just like, not wanting to even discuss things. And that's an issue. I didn't come to this clinic here with the thought in my mind that I was going to be cured. They have excellent reviews, but I knew, I was like, once this money is gone, this money is gone. This is not like the US where, I have legal rights when a doctor uses something that is out of their scope of practice. Here, it's totally legal. Everything that they're doing is legal, and it's basically a shot in the dark. So I'm losing all this money. It's not money that I'm going to get back. I knew that going into it. What I do expect, though, is for them to explain things to me. They actually explained to me why the exosomes treatment had not gone well, and they explained to me how they approach something like that, and what my possible issues are. Am I expecting to be cured? No. I expect to feel a little bit better, but even that may not happen. But if I see that they won't answer questions, if I see that they start doing this whole, you look really good, you look good, you're glowing, this and that, then again, that goes with the beating around the bush, right? You're not giving me a direct answer. You're not telling me what's going on, and because you're trying not to acknowledge the fact that these treatments did not work. And in some cases they don't, right? It's the same thing with allopathic medicine. In some cases, those treatments don't work. And I've done very, very strong treatments in allopathic medicine that have not worked, or that have had, limitations that have worked a little bit. They have to treat it the same way, right? But a lot of naturopathic physicians or alternative medicine physicians, they feel like they've got the cure, and you can't do that. You can't do that, because even traditional medicine doesn't have the cure for a lot of things. So again, overpriced supplements. I might have addressed that in my first video. If you've got a naturopathic doctor that seems very, very confident, but they're prescribing you supplements that have common allergens. I had a naturopath prescribe me she didn't prescribe it. She put on the list of supplements, like one that contains like wool or something derived from wool, and another one that has soy. And it's like, I'm telling you that I'm very sensitive to everything, and I have to stay away from common allergens, and here you are giving me supplements or recommending supplements with common allergens and other stuff. So again, there's that lack of listening. They're not listening. They're not acknowledging that what you're telling them. They're being dismissive. And of course, being very, very overpriced. I saw the cost of the supplements here. They're like 3 to 4 times the price that they are in the United States. They should actually be cheaper here, but I'm guessing because of import costs and things like that, that might be why they're so expensive. But 3 to 4 times, that was like a huge red flag. Apart from the fact that there were other red flags that I saw with this naturopath, I'm not entirely trusting what she's recommending, because I do think that she's not listening, and she doesn't really care to listen. I think she feels that she knows it all. So I think that, that covers just about everything. Oh, one last one. And this is something actually that I guess when you're in a holistic clinic, you're getting holistic treatments and they want to stick to holistic. But I am at a holistic clinic, but there are doctors, regular allopathic doctors that are, overseeing your care. When I see a complete refusal of, and not just with me, they're dealing with cancer patients. They're dealing with some serious cancer patients here, some very, very serious cases of cancer. And when you're dealing with something like that, you cannot be stubborn and say, okay, this patient is in pain or this patient is not feeling well. I'm going to go bust out some essential oils, right? You cannot be stubborn and withhold pharmaceuticals because this is your belief system. And I'm going to say right now, this clinic does not do that. I really appreciate that they don't do that. I was feeling nauseated one day with the IV. It was like vitamin C. It was just vitamin C. And they busted out some pharmaceutical antiemetic. And I was actually surprised because they had kind of done the peppermint oil thing at first. And I think once they saw that I was having difficulty tolerating, the IV, they were just like, okay, we need to bust out the big guns and just, that way she's not feeling so much discomfort. And I've kind of heard that they're doing that as well with some of the other patients, because the other patients have cancer. They've got pain, they've got serious, nausea and all kinds of stuff. And I think that if you are at an alternative medicine clinic, if you're being treated by an MD that just happens to also do alternative medicine, and they refuse to use, allopathic medicine, and they just absolutely refuse it, I really think that that's a huge red flag. If there are MDs at the practice and you can get, some medication to help you tolerate the treatments that you're going through, the alternative treatments, because that's a huge myth. And I also made a video about alternative medicine myths, that there's no side effects. There are tons of side effects. This stuff is really strong. Again, if it's something that works, if it's something that's actually effective, it's going to have side effects and you're going to feel it. How is something going to be effective and be totally comfortable to tolerate? That's not the way it works, So a willingness to bring in what needs to be brought in to make you comfortable and to get you through the treatments is a must. If they're fighting with you, if they're just not, they're not having it, they don't, that's just cruelty. It's cruelty, and it doesn't mean that they're caving into like big pharma or anything. Like I said, natural medicine or natural treatments can be just as hard as allopathic stuff. They can be just as harsh. They can make you really sick. So I think a combination of both is a good sign. If a doctor is willing to use a combination of everything, alternative, allopathic, natural, pharmaceutical, I think that that's a good sign, because they're thinking of the patient first. They're putting the patient first and not dismissing what they're feeling. So that's my list. If you guys have any more to add, please leave them down below in the comments. I'd really appreciate it. It's been a very, very interesting, to have this experience, and I think it could be very helpful for other people out there, and also for like I said, for naturopathic doctors. You want to be taken seriously. You need to act seriously. You need to avoid a lot of these pitfalls here, because that's why people call you quacks, because you're acting like one. Don't act like one. If you don't act like one, people can't can't call you that. If you truly believe that this stuff works, you don't need to resort to psychological mind games or anything. So anyways, this video has gone on long enough. Thank you so much for joining me, and I will see you in the next one. Take care.